Hi, I'm Kaye, Deputy Director of the Office of HIV/AIDS and Infectious Disease Policy at the U.S. Department of Health and Human Services, and delighted to be here. I have with me here Dr. Eugene McCray, Director of the HIV/AIDS Prevention at the Centers for Disease Control and Prevention. Today starts the 22nd Annual U.S. Conference on AIDS, and we are delighted to be here. And we've got a lot going on. So I'm glad to have this opportunity to talk to Dr. McCray about what the CDC is doing and the sessions that they're leading and what's happening. So Dr. McCray, welcome.
Thank you.
Thank you. So tell me, I know CDC is quite busy. Tell us what's going on.
So yeah, we are very busy. We've got a nice contingent of staff here, and our staff are actually going to be doing a number of things, but the focus of most of our work is really on using and talking about the vast data that we have and how we're using those data to improve programs. And particularly, you know, for us, this is a very exciting time in HIV prevention, and we have a lot of good quality data. And the CDC pathway is actually focused on using our data to improve the outcomes of people living with HIV and AIDS. It's also looking at data and other tools that we have to better identify people who are living with HIV or at high risk for HIV, and ensuring that those people get into appropriate treatment and or prevention activities. So I'm very excited, and we're also in collaboration with your office actually. Yes. Is presenting some data on some really wonderful demonstration projects that are funded by the Secretary's Minority AIDS Initiative Fund that are targeted on getting people who are living with HIV into care and keeping them in care, which is sort of what we call data to care.
Right.
And then the other is PrEP, or pre-exposure prophylaxis, a pill that you can take once a day, and that can prevent you from getting HIV through sexual transmission. And those projects are going very well, and hopefully you could tell us a little bit more about that session.
Sure, and what I want to add is our office, as you said, is super busy as well. We actually are teeing off 2 sessions today ourselves as part of our SMAPE Pathways session. We're looking at also 2 hepatitis sessions that we're really leading, in addition to a listening session that we're hosting on our National HIV/AIDS Strategy and our National Viral Hepatitis Action Plan update. So again, our office, OHADIP as we call it, is as busy as CDC.
Sure.
So it's great to hear. Now, when you talk about what's happening with data, for me that's a very consistent message I've heard throughout the day and throughout the summer. I talked to Antigone Dempsey earlier, and she talked about what HRSA was doing and its sessions on data. So if you could give me a little bit more about CDC specifically and what's happening there.
Sure. So one of the sessions is actually focused primarily on using surveillance data to help people who live with HIV get in care and stay in care. So one of the things that we've seen from our data is that about 50% of our folks who are living with HIV, either diagnosed HIV, as many as 40-50% are not consistently in care. And what we do is we use surveillance data and other data to help us identify people who have fallen out of care and then get them back into care. But it's not enough to get them back into care. We have to look at the systems that we are using are getting them back into, to make sure those systems are supporting them appropriately so that they can get in care, stay in care, and stay what we call sustainably virally suppressed. Because we know for us, viral suppression is one of the most important things that we can do to prevent HIV transmission. It's also very important for the individual, because if you are living with HIV and you get on treatment early and you are virally suppressed, you can live a long, healthy life, and the life expectancy is similar to a person who is not living with HIV.
Right. And I think it's important to note that when we talk about the Secretary's Minority AIDS Initiative Fund, CDC is our partner, because OHADIP, the department, can't do this work alone. We work in concert with CDC, who's been a tremendous partner, HRSA, SAMHSA. When I say HRSA, the Health Resources and Services Administration, the Indian Health Service, SAMHSA, our Substance Abuse and Mental Health Services. So you guys are all our partners, and that's important because we really cannot do this alone. And we rely on communities to help us do this work that we do. So it's nice to hear that our SMAFE efforts have extended to CDC and that their sessions are moving forward down that path.
And your comments actually just lead into another point that I wanted to make. And one of the other sessions that we're doing is really talking about how our data can be used by community and making sure community understand what data are out there and how they can use those data to help improve outcomes for people living with HIV in their communities, as well as improve the uptake of prevention interventions for people who are at high risk for HIV. And one of the new tools that we have is something that we called molecular surveillance. Molecular surveillance is new. There's the community doesn't understand and know a lot about molecular surveillance, so it's going to be really important for us at this meeting to begin a discussion with the community about molecular surveillance so that we can help them understand what this new tool is and how it can be used to help both prevent acquisition of new infection as well as identify people who are living with HIV who need to be on treatment and in care. So and so one of the things I'm going to be shameful here and make an announcement. Tomorrow at 6:15 we're going to be having a special session where we're going to be talking about molecular surveillance, basically explaining what it is not, and then so that everybody is working on the same level, and then begin to have discussions with the community about their concerns. We want to hear their concerns and then begin to address those concerns collaboratively with the community, because for us to really make a difference and get to no new HIV infection, the community has to be an important part of that. And so, and we believe that molecular surveillance is an important tool that can help us continue to see the downward trends that we're seeing in HIV in the U.S.
Right. So a couple of things you said that I honed in on. One is the beginning of these discussions. I think that's critical. Two, it's an opportunity to bring community together so we can learn. I need to be at the session, 6:15 tomorrow. Because I think those are all the kinds of things community needs to hear and understand and have those beginning discussions as you move forward. And then the other thing I heard was the new tool for our toolbox. And I think that's critical as we figure out and find out exactly what we need to do, what works best, how we use these tools, how we reach the communities we most need to reach.
Yes.
So I really thank CDC for really being a partner in these efforts moving forward. So what have I missed? What else do I need to ask you? What else is going on?
Well, there's a lot going on that CDC is not doing that we're interested in, but mostly, many of my staff are here because we believe that our engagement with the community is so important. This is a meeting that has lots of people from the community. They need to know about the work that we're doing. We need to know from them about the work that they're doing. We learn a lot at these meetings about innovative community-based solutions that are being implemented, and we want to see if we can. We're learning as well. And I'm always excited to come to this meeting and look forward to actually the next 3 days.
Okay, great. With that, we want to say thank you. Thank you for joining in and listening. Look in your booklet, see all the sessions. Remember the session tomorrow is 6:15. The OHADIP sessions, we have 2 going on this afternoon, one at 2 o'clock, which will be starting very shortly, and then another at 4. Thank you very much, and we look forward to hearing from you soon.
Thank you.
All right, good.